Thank you. So this is research that I did for my master's thesis, and sort of my motivation for this came from a couple of places. I was severely gay bashed myself when I was 22, and so I know how the experience had affected me. And it was something that I didn't talk about to many people. And later on, as I was doing my Master's of Social Work, I thought, this could be interesting. I wonder how this affects other people. I'm imagining it's the same, but I don't know that. So my hope was to see what participants' understandings of their experiences were, as well as to look at systemic responses to gay bashing and come up with some recommendations. And so some of the different areas that I looked at, specifically because my field is social work, was the field of social work, healthcare, policing, education, and also communities' reactions to gay bashings, how we as a community respond to this. So it's a small study, and it's a qualitative study. Because it's qualitative, the challenges are that you can't necessarily take this data or the results and apply it to everyone. But there is some really interesting results, and I presented this a few times, and afterwards I always talk with men that come up to me and say, like, yeah, that was my experience too. And that's happened in Toronto and Montreal, and last year I presented at the Out Games here in Vancouver and had some really great sad discussions with men that had also been bashed that sort of saw themselves in this as well. So 7 men were recruited, and it was really interesting when I was doing the recruitment process. Lots of people came to me and said, oh, I know someone that was gay bashed, I'm going to tell them about your study. And then I never heard from that person. So I would follow up with the person that had told me, and they were like, yeah, I talked to him, he doesn't want to talk about it. And that happened over and over and over and over. So this is something that people that have been bashed don't want to talk about. The definition was left open to define, so it could be just verbal harassment as well as physical violence. Of the 6 men, 4 of them experienced physical violence, and 3 of them required hospitalization. 1 of these also experienced ongoing verbal harassment, and 2 of the men had experienced just ongoing verbal harassment. And so the next couple of slides are just some quick snapshots of the men. And it was a varied group. So Kevin was in his 40s, he's black, originally from northern Manitoba, had worked in the sex trade, HIV positive, and he was bashed in '97. Rick, early 30s, Aboriginal, bashed in 2000. Dan, mid-40s, white, grew up in rural Manitoba, described himself as obviously gay and says that he's very stereotypical, that everyone knows that he's gay. Repeatedly bashed and harassed. Todd, late 40s at the time of the interview. White, he's was a well-known drag queen and an ambassador to the community is how he saw himself, HIV positive. Bashed in '87 while he was walking in an area of Winnipeg that's known for cruising. And he's since passed away. Jeff, mid-30s, white, harassed and threatened on 2 separate occasions, both incidences while he was walking with his boyfriend. Matt, these are all pseudonyms, of course, but good to put that out. Late 30s, white, repeated indirect harassment and homophobia. So Matt was somebody who passed as straight, and experienced really indirect homophobia because there was an out gay teacher in his school that experienced a lot of direct homophobia. And Matt sort of had all of these side effects of listening and hearing and people making jokes and comments and remarks about this other teacher that also applied to him. So as I said, it's a qualitative research study. It was an anti-oppressive practice approach. And the interviews were analyzed using grounded theory. Once everything was done, the data and research findings were first presented to an outside committee made up of 3 folks from the community in Winnipeg that have a lot of experience working with and knowledge of the community with men that had been bashed. And then this was then put forward to my thesis committee. The question that came out of the research itself, because with grounded theory the question comes out of the research, is how do various types of homophobia experienced by gay men affect them, and what's the process that occurs within their own lives in understanding and viewing their place in society, and how they combat homophobia. And there was 8 themes that arose out of everything when everything was analyzed. Personal experiences of homophobia, fighting back, heteronormativity, identity and identity change, reaching out, and that involved disclosing what had happened as well as reaching out for support, isolation, power, powerlessness, and privilege, and the theme of creating change. And so some of the things that came out of people's personal experiences of homophobia, it's common. It happens all the time. When it's a physical attack, there's usually multiple attackers that were male. The physical violence is quite extreme, and physical violence also includes verbal harassment. Those two always went together with the men that I interviewed. There was weapons, and it was unprovoked. These weren't men that were doing anything asking to be gay bashed. They were just living their lives, walking down the street, trying to get home, going places, waiting for somebody. And this was intentional homophobia and violence. Whether or not someone went out to intentionally do it, they intentionally made a decision to bash these men. So 5 of the 6, it was intentional towards them, and the 6th one was the teacher that experienced everything indirectly. The theme of fighting back, the men fought back verbally. When they were being bashed, they stood up for themselves, they fought back, they called for help. So they were fighting back verbally. They were also fighting back physically. They defended themselves. They tried to fight off their attackers. They also fought back in terms of their responsiveness to the incident afterwards, in things like community awareness, talking about it with members of the community about what had happened and warning people. One of the people that had been bashed reported to the police, who did nothing, and so he made his own posters up of describing the person that had bashed him and posted them up in the cruising ground area. And this was behind a curling club on a riverbank in Winnipeg, and he spray painted a big warning that this is a gay bashing area and there's lots of gay bashing happening here, so if you're cruising, beware. So it was sort of an interesting thing. One of the people that I interviewed that was a drag queen talked about using drag and performance as a way to combat ideas around gender and sexuality, and that this was his way. He went into drag after being bashed as a way to fight back. So heteronormativity was a theme. So the use of time and space. These were men that were all just being themselves, but for whatever reason, they weren't perceived as being masculine or as being heterosexual, and so they were in the wrong time and the wrong space. And so even when they were in a place that was a gay area, outside of a gay club or in a gay cruising ground, violence was used to teach them a lesson, that you should act a certain way, you shouldn't be here, you shouldn't do these things. So it was used to let them know that this wasn't okay, that who you are isn't accepted. And this was reinforced with the messages delivered from the attackers, as well as from supporters. When folks came out and told what had happened, people said, like, well, what were you thinking? Why were you in a cruising area? Well, why were you waiting out there? You know that that's a bad area. Well, what were you wearing? Why were you wearing that? Lots of the messages that we hear around women that have been sexually assaulted, these were messages that men that had been gay bashed also received. So lots of victim blaming and internalized responsibility then as a result, because when you're reaching out for help, and these are the people that you're reaching out to for support, and they're sort of giving you these messages back, you internalize that. Identity and identity change. There were shifts in things like their out identity. They described themselves as being less out. They dressed things down. Someone that used to be flamboyant wasn't so flamboyant anymore. Things around awareness. They had a heightened awareness to everything that was going on around them. If someone said the word fag, 30 feet away, they heard it, and they were clued into everything. If they heard a twig cracking behind them, they clued in on those things. So hypersensitive and hyper-awareness. Lots of mental health concerns that came out of things. The men that weren't Caucasian also experienced racism during their attacks. There was lots of racist comments that were made, and lots of behavior changes that came out of this for them in terms of things like their relationships, their ability to be intimate with their partners, how they interacted with their partners in public. People that used to hold hands no longer did, didn't go to the same places, didn't want to go to the bars, didn't want to be out after a certain time of night, things like that. And when reaching out, when trying to figure out how they were going to tell people about what happened, there was a few things that happened. So if they had control, if this was them making a decision to sell somebody, they decided if the person was supportive or not supportive. And if this person was not supportive, they didn't tell them. If it was someone that was supportive, they made a decision to either reach out for help or to protect the person. That there were several people that talked about they did reach out to their friends, but they didn't tell their family about what had happened because they didn't want to burden their family or didn't want to worry their family. When they had no control, when police were involved, they based their decisions around did they feel that they could trust the officer or not trust the officer. And if they did, they were open and honest, and not a lot came out of it, sadly. And if they felt that they couldn't trust them, they just shut down and didn't share much with them. So also in terms of reaching out, coping methods, there was lots of different things that they did around coping. Isolation, which is a theme in itself, but also things like use of alcohol to cope, use of drugs to cope. Shared experiences, that this was helpful for them, sharing their experiences with people and also hearing that other people went through this experience in the community. And also in terms of reaching out, concrete things were really helpful, they identified. They didn't necessarily need to tell their story and have someone listen to them. They didn't necessarily need a counselor, but they did need someone to come over and help them clean their apartment because they hadn't done it in 2 weeks and they hadn't been out of bed in three days. So lots of concrete stuff was just helpful for them, they identified. And also in terms of disclosure and support, just re-experiencing homophobia in terms of, again, when they did disclose to people, the folks' reactions really triggered a lot of stuff for them. Isolation came out of it, feeling alone as a result of reactions, or that they could tell people and what happened, or that they couldn't tell people. So there was lots of self-isolating behavior. Lots of folks identified that they felt like they couldn't leave their home. They couldn't take public transportation anymore because if they had to run, if they had to get off the bus, they couldn't do that. So it really impacted things like how they got around, how they went to work. One man actually ended up quitting his job because public transportation just wasn't an option and he didn't have a license. And isolation was also used as a coping method. The theme of power, powerlessness, and privilege. Power over was really made clear to them that they had no power and their bashers had all the power. In terms of the language that was used towards them, it was homophobic, it was racist and degrading, and violence. Who was experiencing it and who was dishing it out. And their awareness to privilege, the use of privilege and who has privilege. They didn't have any of that in these situations. Although, later on, they were able to use what power they did have and the privilege that they did have to create change and to make change. And so a common theme that came through all of them was just the resiliency of them to use the power within them to do things and to create change. And so there was things like active change. They talked about the careers that they chose as a result of this. One person is a health educator. One person is a social worker. One person went into law and does human rights law. So there was lots of stuff around careers that they see as motivated out of their experience. Volunteerism within the community and also just community involvement. They identified and connected to their experience. And also their ideas on change, what has to happen. They think that there needs to be anti-homophobia education just at large and in general to the public, but it also needs to start within the school systems, and that diversity promotion needs to start within the family. And realizing that these lessons get taught to children from people, so families might not teach their kids these values, and that's why it needs to happen within the school system. So some of the findings: verbal harassment versus physical violence, it wasn't that different. They impacted men the same. Their sense of self and their identity and their level of being out all switched. Mental health concerns, post-traumatic stress disorder. They experienced things like anxiety, depression. One person hadn't been diagnosed as bipolar and had never had any sort of mental health concerns. And after his bashing, was diagnosed as being bipolar. And he really sees that he connects the bashing to bringing this out. Whether it was there or not, he sees the bashing as the thing that triggered it. None of them were diagnosed with post-traumatic stress disorder, but when you look at everything that they've gone through, it's post-traumatic stress disorder. And the resiliency in survivors. So learning from their experiences, What are the things that would be helpful? Connecting with other people. So staying in touch with them, calling, whether they're calling you back or not, whether they're reaching out for help or not. Seeing what they need and asking about what kind of support they want. And doing the concrete supports like going to the grocery store, helping them clean their apartment. These might not seem like helpful, but these men identify them as super helpful for them. Creating a sense of trust and service delivery. If it feels like they're being treated like a human being and that they can trust the person, they'll open up. And then there's the potential that they might get some help. So some of the recommendations for social work is just that this needs to start with education, that there needs to be an awareness and a training around LGBT issues. Social workers in my province and in my faculty get a really shitty education around LGBT issues in the BSW program as well as the MSW program. That there needs to be training around LGBT issues in general, and that this needs to then continue on once you become licensed. Same thing with medical and healthcare. At my agency, we're the ones that go out and we deliver training to the doctors, and we get 3 hours, and that's all they get throughout their 7-year training as a doctor. It's ridiculous. So there needs to be a much more inclusive and developed training and curriculum that's used for medical and healthcare practitioners. And the use of community knowledge and expertise, that these need to be involved in delivering that training. With policing, there needs to be training around these issues as well. The development of a more open and accepting work environment, and connecting with the police forces so that LGBTQ members feel trust, the gay men feel trust towards police officers. Having police present at things like Pride, or having them present at our resource center in a positive way. Being at community events. And for school systems, better policies and practice implemented for dealing with verbal homophobia, the development of a more open and accepting work environment where staff can be out, the freedom to discuss issues, and the development and support of GSAs within school systems. The biggest thing that impacted me, and lots of the men as well, was just for our community. As a community, we need to respond to this in a better way, that we shouldn't be blaming, we should be supporting. And we need to also change our reaction from normalization to outrage. One of the big themes that came out of it was that, yeah, this is really shitty, it's awful, it happens to all gay men, what are you going to do? And that was helpful. The men identified that as helpful to hear that this is something that lots of gay men go through. But it's really awful that that's our reaction. What are you going to do? That this is sort of a rite of passage that we all go through, we all get bashed, and we all experience this horrible violence or harassment. Oh well. That we shouldn't be normalizing this. We should be outraged, and we should be creating a different dialogue within our own community. And that's all I got. Thank you.